There's one thing your doctor probably didn't tell you at your last checkup. It's not a pill. It's not a supplement. It's something you already do every day, just not enough of it. And doctors are now saying it may be the single biggest factor in whether your joint pain gets worse or actually gets better after 60. Here's why this matters so much. Millions of people over 60 wake up, feel that familiar stiffness in their knees or hips, and quietly decide to just live with it. They stop taking walks. They avoid stairs. They tell themselves this is just what getting older feels like. But what if that decision, made with the best intentions, is actually making things worse? Stick with me, because by the end of this video, you'll know exactly what your joints need, how little it actually takes, the one mistake that quietly makes joint pain worse for so many people, and 2 other daily factors almost nobody connects to joint pain until it's too late. First, let's talk about what's really happening inside your joints, because most people have this part wrong. Cartilage, the cushion between your bones, naturally thins with age. The fluid that keeps your joints moving smoothly also decreases. The Mayo Clinic identifies this process as a major driver of osteoarthritis, one of the most common causes of joint pain in older adults. So picture this. You're 65. Standing up from the couch used to be effortless. Now it takes a second push, maybe a hand on the armrest. It feels like your body is betraying you. But here's what almost nobody tells you at this stage. Your joints don't have their own blood supply. That means the cartilage inside them can't get nutrients delivered the way the rest of your body does. Instead, it relies almost entirely on movement to pump fluid in and waste out. The Centers for Disease Control and Prevention confirms that regular physical activity is one of the most effective tools for reducing arthritis pain and improving joint function. Sit still too long, and that fluid stops circulating. Stiffness creeps in. Pain follows, which means the instinct so many of us have to rest a sore joint completely might be the exact opposite of what it needs. Walking. Specifically, short, low-impact walking, done consistently, not intensely. The National Institute on Aging points to walking as one of the safest, most effective habits for older adults dealing with joint discomfort, because it strengthens the muscles surrounding the joint without overloading it. Think of a 70-year-old man who avoided walking for years because of hip pain. He starts with 10 minutes around his kitchen, just 10. Within weeks, the muscles supporting that hip grow stronger, and that extra support takes pressure off the joint itself. It sounds almost too simple, but simple isn't the same as ineffective. Now here's something that surprises almost everyone. You don't need long walks to see results. The American Heart Association notes that even moderate activity, broken into shorter sessions throughout the day, improves joint health and mobility. A 10-minute walk after breakfast, another after lunch, one more in the evening while the news is on. That's it. No gym, no equipment, just movement, spread out, done on purpose. And if the idea of exercising for 30 minutes straight has been holding you back, this changes everything. But there's a catch, and it's the part most people get wrong. It's not about how hard you push. It's about how often you show up. The Cleveland Clinic emphasizes that gentle, regular movement done most days of the week produces better long-term results for joint pain than occasional intense exercise. This explains something a lot of people have experienced without understanding why. You have a good day, you push yourself, maybe garden for 2 hours or walk further than usual, and the next morning you're paying for it. That's not your body failing you. That's your body telling you the rhythm was broken, not the effort. Now let's talk about something walking alone can't fix, and it's a piece most people never hear about: muscle strength. The muscles around your joints act like natural shock absorbers, and after 60, muscle mass naturally declines if it isn't actively maintained. The National Institute on Aging explains that strength training, even light resistance work using bands or your own body weight, helps preserve the muscle that protects your joints from added stress. This doesn't mean lifting heavy weights at a gym. It can mean standing up from a chair without using your hands, 10 times in a row. It can mean holding onto a countertop and slowly rising onto your toes. Small movements like these, done a few times a week, build the kind of support your joints depend on every single day. Sleep affects your joints more than most people realize. When you're not sleeping well, your body produces more inflammatory markers, chemicals linked to increased pain sensitivity. The Cleveland Clinic has noted that poor sleep quality can worsen the perception of pain, including joint pain, creating a frustrating cycle where pain disrupts sleep and lack of sleep makes pain feel worse the next day. If you've ever noticed your joints feel more tender after a rough night, this is likely why. Improving sleep isn't just about feeling rested. It may directly influence how much pain you feel walking to the kitchen the next morning. Posture plays a quieter role too, one that builds up slowly over years without anyone noticing. Sitting for long periods with poor alignment, hunched over a phone, or leaning to one side in a favorite chair can place uneven pressure on your hips, knees, and spine. Over time, this uneven pressure can accelerate wear in certain joints more than others. Simple awareness, sitting with your feet flat on the floor, keeping your back supported, standing up and resetting your posture every hour can reduce unnecessary strain you didn't even know you were creating. So what if walking isn't realistic for you right now? You're not out of options. Water-based exercise is another path experts recommend often, and for good reason. The buoyancy of water takes weight off your joints while your muscles still do the work. The National Institute on Aging highlights water exercise as especially valuable for people with arthritis or significant joint pain, since it allows movement with a fraction of the impact of walking on land. If stairs feel impossible today, this might be exactly where you start instead. Here's the mistake that quietly makes everything worse: staying still. Full days spent sitting or lying down feel like rest, but the CDC warns that prolonged inactivity is directly linked to increased joint stiffness and muscle weakness in older adults. This creates a cycle almost nobody talks about. Pain leads to less movement. Less movement leads to more pain. And that cycle can go on for years unless something interrupts it. Sometimes, the interruption is smaller than you'd expect. So where do you actually begin? If you're dealing with real pain right now, you don't start with 30 minutes. You start with 5. Walk to your mailbox and back. Walk the length of your hallway during a commercial break. The Mayo Clinic recommends increasing activity gradually rather than pushing hard too soon, which can lead to setbacks that discourage people from continuing at all. Mild discomfort when starting something new is normal. Sharp or worsening pain is not, and that's your signal to stop and check in with your doctor. And this next part matters, so don't skip it. If your joint pain comes on suddenly, or if you notice swelling, redness, or warmth around the joint, this isn't something to manage with a walk around the block. Those can be signs of gout, infection, or inflammatory arthritis, conditions that need real medical evaluation, not home remedies. A healthcare provider can help you understand what's actually causing your pain and whether physical therapy, medication, or a combination of treatments alongside movement is the right path for you. Let's bring it all together, because there's more here than just one habit. The daily walking doctors recommend for joint pain after 60 is consistent, low-impact movement, spread through the day. Not intense, not overwhelming. But that walking works even better alongside light strength exercises that protect your joints, quality sleep that lowers inflammation, and simple posture awareness that reduces unnecessary strain. None of these require expensive equipment or drastic life changes. They require small, steady choices repeated often enough to matter. If this gave you something useful today, hit like so more people dealing with the same pain can find it too. Subscribe if you want real, doctor-backed health information without the hype. And I want to know, what's one small step you're going to take today, whether it's a short walk, Standing up from your chair without your hands, or just going to bed 20 minutes earlier tonight? Tell me in the comments. I read every one.